Good afternoon, everyone. Welcome to the COVID-19 New Crisis, Same Stories series. In episode 1, you met with the leaders behind the scenes of Prosperity Now's Racial Wealth Divide Initiative team. They shared the highlights of the experiences of nonprofit leaders they collaborate with across the country, what they have learned, and what you can learn about these grassroots community innovators. The voices of these leaders and their experiences are captured in our report, COVID-19 New Crisis, Same Story, highlighting the innovations to racial economic inequality from leaders of color. In today's episode, we are focusing on health. The second episode in the Racial Economic Equity series introduces community leaders in Wilmington, Baltimore, and Chicago working to disrupt racial economic inequality by creating solutions that work to improve social, economic, and political systems that dictate the social determinants of health, the conditions in which we work, live, play, and pray. In today's episode, we are going to review the macro, micro, and meso implications of structural inequality on health and wealth. We'll then highlight the experiences of nonprofit leaders of color during COVID-19 related to social determinants of health. And then we'll close by discussing upstream solutions and the interventions targeted to institutions, systems, and structures. And with that, I'll introduce today's speakers. Today's conversation will be moderated by Kat Guggenauer, who's the Associate Director of Racial Wealth Equity at Prosperity Now. We're also joined by Logan Herring, who is the Chief Executive Officer at Reach Riverside, Althea Saunders Rainier, who is the Director of Financial Services and Education at Bon Secours Community Works. And we're also joined by Dennis Mondera, who is the Executive Director of Chinese Mutual Aid Association. And with that, I will turn things over to Kat to get us started.
Thank you, Tupa. So on today's episode, we are going to think and speak very broadly about what health means. As officially defined by the World Health Organization, public health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. According to the World Health Organization as well, the main determinants of health include the social and economic and physical environments in which we live. These are known as the social determinants of health, and they include education, employment, income, housing, wealth status. And it's been found that these are more impactful on the health and outcomes of individuals than their choices, behaviors, and habits. In this country, we've had an approach where we always blame the victim of circumstance for their own suffering. So this new way of thinking about and looking at health actually allows us to see the structural, systemic, and institutional factors driving inequality, and allows us to then target solutions to those long-standing factors so that we can make change for this generation and future generations. As COVID-19 and the coronavirus have shown, we had a pandemic within a pandemic. We were already dealing with structural racial economic inequality for communities of color, as well as for low-income people over time. We see with the disparate ways that COVID-19 is impacting communities, both the rate at which they're contracting the disease, but also dying from the disease, that this is a pandemic, that there is something oversized that's happening for our communities. And then on top of that, we're seeing how structural state violence is also impacting communities. So at this moment in time, we actually have an amazing opportunity to think a little bit differently about how society is run in the past, to understand that what we are seeing at the health and wealth level is predictable, but it's also preventable. We also know that the people closest to the solution are closest to the problem, are closest to the solution, and that there are several ways to deal with the issues we see in our communities. We can look at solution making as prevention of the issue. We can also look at it as ways to reduce harm, or then ways to cure that root cause. And there are multiple ways to do this as well at a macro, meso, or micro level, either at the structural level, looking at the laws and policies, the organizational or institutional level. I'm really looking at how we can impact communities on a little more close to home. And then the micro level, thinking about families and individuals and how we can use all of our resources or draw new resources to change the outcomes for our community members. what we're seeing from the APM Research Lab is that COVID-19 mortality rates for Black Americans are almost 2.5 times as high as the rate for white people. They're almost 2.2 times as high as the rate for Asians and Latinos. But what we're also seeing is that those communities are also disparately impacted with the number of contagions as well as the people who are impacted by death. We heard from our leaders that there are ways that we can deal with these issues, and they're here to share with us the way they're responding to these issues. We look forward to having this important conversation and want to welcome our guests today. We'll start with Logan. Logan, can you tell us a little bit more about what's happening in Delaware, what you're seeing in the community and both the data as well as what you're hearing from clients, and then what your community is doing to respond?
Yeah, thank you, Kat, and thank you, Prosperity Now, for providing this opportunity for me to speak about what's taking place in Wilmington. And what's happening in Wilmington is no different than what's happening around the country and the things that you just spoke of, particularly in our communities, our Black communities, our communities of color. Riverside is not unlike any other of those communities. And when we talk about the vulnerabilities that our Black communities face, we must talk about how those vulnerabilities came into play in the first place. Riverside is a product of redlining. It's a product of a public housing community that was once a community for white veterans that came back from war, but now Black people live in it because of white flight, which provided white Americans with $120 billion of mortgages federally backed from the government, of which 2% Black people had opportunity to that funding. Riverside is a product of the GI Bill, or the lack thereof, that was unafforded to Black veterans coming back from war. Riverside is a product of the crack epidemic, which was treated as a criminal justice issue, which tore apart the fabric of our communities, the fabric of our families, as 1 in 4 African American males was either locked up or on parole. So Riverside is a product of all of those systemic racist policies and practices that have led it to be the vulnerable population and community that it is now. So at Reach Riverside, our mission is to eliminate the barriers of structural racism. And we do that through a 3-pronged approach: redevelopment, education, and community health. Building affordable housing, making sure that we have the best educational opportunities and resources that are available, not just in Riverside, but anywhere. And then community health options, whether it's physical, mental, access, all of the things that make a community more healthier, even including safety. So as we look at this pandemic and it comes into play a few months ago, we realized that we were already doing relief work before we were hit with COVID. And we decided to double down and start a Riverside Relief Fund to provide assistance and greater assistance than we were already providing prior to COVID. So the first thing we started with was cash assistance, $250 per month for 3 months to every single household in a public housing community, making sure we just step in the gap there with the financial assistance that every household needs, not just Riverside, but every household. But we wanted to focus our attention on Riverside. The second thing we did was focus on health and making sure that we have screening and testing available twice a week at our community center. Through this screening in the first 6 weeks, we've screened 126 individuals, 93 have been tested, and 25% of those individuals came back positive, 23 people. So again, we see everything that is being perpetuated and seen all throughout the country is that Black people are being affected at disproportionate rates. We are also addressing the digital divide now that everyone is at home and doesn't have access to the technology that they might get in home or might get in their workplace. We are seeing that we needed to step in there. So we're providing over 400 Chromebooks to all of our homes in the Riverside neighborhood. And then we're also addressing food insecurities by providing meals and partnering with our food bank. Last but not least, we are now stepping into the space of racial justice and equity work, providing platforms for our youth to speak to those people that are in positions to make decisions, elected officials, your chief of police and such. We want to continue this work, and we are happy to be here to be able to share with everyone the solutions that we're seeing on the ground, understanding that these solutions in some part are short term, and this is a marathon, and we need to continue this work for the long haul, not just for the next day or week or month when it's a trendy topic, but for the long haul. as we are in a marathon. Thank you for having me, and thank you for all the other panels for joining as well.
Thank you, Logan. And it's really inspiring to hear how you conceptualize the work you've already been doing in community. It really speaks to that pandemic in a pandemic, right? The long-standing issues. So you already were doing relief work, but how you kind of doubled down and are being very responsive to the needs of people, not just thinking about their health in a very prescribed way, but actually getting dollars into the pockets of families, understanding the need for a multi-generational approach, and then seeing how once you take care of the basic needs of people, how they can become their own first advocates. And so we're very inspired by what you all are doing and really look forward to seeing what some of those longer term, larger impacts are as your program matures and you receive more dollars to do the great work. With that, I do want to turn to Althea and hear a little bit more about what's happening for you all in Baltimore. I'm thinking about the data, what you're hearing from clients, and how your organization is responding to those needs.
Well, thank you. And as well, I want to thank Prosperity Now for the opportunity to have this conversation about the work we're doing on the ground. Not only the problems, but the efforts you're allowing us to have in terms of working towards solutions. Bon Secours is in Southwest Baltimore, predominantly African-American community. And like many communities, it has suffered white flight, drugs, and numerous things that have kept families down. And with little investment in communities of color when whites left there, these neighborhoods have had to be their own best advocate in many ways. One thing I can say is that they are the great survivalists because no matter what, they continue to move past some of the struggles. We have housing units, and as Director of Financial Services, we're working with our residents. We have a 273 family unit, and we're in families are now challenged because of the pandemic. The one thing is, as we look at social determinants, this was something that we didn't hear much about, and it moved forward very quickly as it exposed the institutional and systemic issues within community. And so it was very important that we get on top of it. We're a food desert as well, so we have urban farming. And so as a result of the pandemic, we have, and we had 75 families. We've expanded that to 150 because families need access to food. As well, many of the families that live in our housing are essential workers. Who would know that, they would be on the front line, and now they seem to be the ones that everybody turns to. And as a result of that, rent has been an issue for many of these families. And so this income, as we know it, is a problem. And we have to understand that when we talk about social determinants of health, that this divide not only affects income, it affects healthcare, it affects everything that we do. But the big problem with it is that the access is also, we're the last ones to get the access. And so families are struggling, and they have taken their stimulus checks and they've attempted to keep up with their rent. And that has been something that has been very helpful. But what we're trying to do as well is continue our platform through our financial capabilities, which we work with our families, trying to have them move forward because of the structural and institutional racism, and help them to be empowered through understanding their power as a people. We have town halls for our residents. And in this way, what it allows them to do is understand where their power is. And so with this being an election year, we are informing them on the power of the vote, not just on the fact that we vote for president, but the down ballot vote, how important that is to your community, because these are the people who answered for you, in our case in Annapolis, and then further down to Washington. So it is very important that these families understand what kind of power. As well, we're looking through advocacy, because I think that, while we can do a lot on the nonprofit level, we need legislation. And unfortunately, this pandemic and now with what has happened in the social justice side, with what happened in Minneapolis, we're seeing a bigger take on us trying to move along through the legislative process. And I think that this is going to be needed if we really want to move our families forward. And so while it is great with the work that we're doing as we empower the families, it is very important that we really lock horns and get some legislation that changes the outlook for our families, because it is very important.
Thank you so much, Althea. I think there are many important things in what you've said. Really what resonated is the impact of this stress, the chronic stress of instability, and how that can correlate with these underlying conditions we're hearing so much about. And then thinking about also how people in the community can become their own advocates, how now we have permission to speak about the kinds of violence that we know we've been experiencing either at the hands of police, but also at the hands of the systems and structures that we live within. And so being able to help people to make the most of this time that they're out of school and out of work and back in their communities is very, very powerful. And so thank you so much for that great work you're doing. Dennis, Althea also talked about, essential workers, and I know that your community is really on the front line doing multi-generational work as well, to speak to Logan's point. And so it would be really important to hear from you also how your community is faring, and then what you're all doing to support those efforts.
Thank you, Kat, and thanks for allowing me to participate and share the perspective of the Asian American voice. As a leader of the Asian American community in Chicago, it's also important for me to affirm to our audience here that we know the fundamental truth that Black Lives Matter. My nonprofit organization in Chicago serves clients who are immigrants and foreign language speakers. Many in our immigrant community make their living as essential workers, whether in factories, food processing plants, cashiers at grocery stores, or delivery drivers. Several of my agency's frontline staff are also essential workers, working directly with the elderly and disabled as home care aides. When the COVID pandemic hit, our agency did not have enough PPE. I didn't even know that it stood for personal protective equipment like face masks and rubber gloves. And this is for our essential workers who make only minimum wage. And it has been such an exhaustive effort for our team to find and source face masks and gloves for them, let alone budget over $10,000 more per month on all this PPE. Another operational issue from the pandemic has been our hampered ability to deliver our other traditional services to our clients. For instance, Chinese Mutual Aid works directly with community members, providing early learning classes for youth and English as a second language classes for adults. In this COVID-19 world, our classes have gone virtual from in person, and it can take 2 or more hours for one employee to teach a client how to access Zoom, assuming that client even has a computer or tablet, as well as access to reliable internet services. Despite all the good work we're doing and the positive contributions that our Asian American community have had on the broader Chicagoland region, particularly with the high percentage of immigrants that work in healthcare and emergency rooms, we've noticed a significant increase in violence against our community members because some have labeled COVID-19 as the China virus. The Asian American community has heard and seen many reports of increased racism, anti-Asian rhetoric telling us to go back to China, and many instances of real violence. Recently, a man in Midland, Texas, attacked a family with children's ages 2 and 6 in a grocery store merely because they looked Chinese. Yes, that's right. This guy attacked a 2-year-old with a knife, and the attacker attributed the COVID epidemic to them. All this again, even though many of our community members are essential workers and healthcare workers, sacrificing their own personal safety in the emergency room to help save others. Sadly, it's created, as Kat referenced earlier, that pandemic within the pandemic. As Asian immigrants are shunned and told we're not American, all the while continuing to help those in need, such as the thousands of Filipino nurses, immigrant nurses in emergency rooms across the country. To conclude, I want to thank Prosperity Now for putting on this important series so we can continue to share our ideas, concerns, offer up solutions, and have a path to heal. In Chicago, we're also setting up several town halls and meetings with elected officials and community leaders about how we can come together as a city, region, and state. Like Logan, our organization is providing laptops and tablets to our students for remote learning, and we are also providing grant assistance to many in our community because they can't pay the next month's rent. Our country needs viable solutions on how we can end systemic racism, and this forum by Prosperity Now is essential to help us analytically think through possible workable solutions.
Thank you so much, Dennis. I think you're going to take my job here. Thank you for all of you saying yes to this opportunity, to coming forward and really talking about how racism and discrimination, structural inequality are all public health issues. They're also exacerbated by police violence and the ways that we tend not to care about communities of color, either in word or in deed. I would say at this moment, we have an outpouring in the streets every day for the past 2 weeks, showing how many people are starting to get it, right? Starting to understand the lived experiences we've all known too intimately for too long. And there are also some early indications that there are going to be some shifts in the systems, the institutions, and the structures. What we need to do is make sure that the solutions our community needs, our communities need, are front and center, right? That this isn't being done for us, but it's being done with and by us, that we are self-determined and able to create the new normal that we need to see and ensure that there is a shift. What I've heard from you all and what we've heard from our community leaders is that we need more funding. All of our organizations are doing more with less, and the needs are greater because we now understand the interconnectedness of all the issues our communities are facing. We also really need there to be money going directly into the pockets of the people who are low income and low wealth. As we've pointed out, some of these things are set to sunset, if it's the stimulus package or rent moratoriums. And so we're trying to save off what could be an even more egregious epidemic and pandemic. We also really need there to be power sharing and a new way of thinking about the leadership of communities of color, that we not only are at the table, but we're creating the tables and we're determining the agendas and how things need to change. I want to thank you, Logan, Althea, and Dennis, all for joining us for this important conversation. You've given us tons to think about. You've also given us precedent so that we know that things aren't just possible, they're already happening. And you've given us actions to take, which is very inspiring to someone like me. Join us, everyone, for the next episode airing July 1st, when my colleagues will talk with leaders of color about the connection between employment and racial economic equity and what can be done about it. Thank you, everyone.
Thank you.